You have been watching Live It Up. I'm Lee Aker here with Stacy Hansen, and now we get to talk to the beautiful lady of the hour. We have Dr. Stacy Shropshire with us.
Hello.
She's the owner of Evolution Body Transformation. How are you doing today?
I'm amazing. Thank you guys for coming.
Thanks for having us.
Beautiful.
Oh, thank you.
You too.
You do too. It's beautiful here.
Yes, absolutely.
Yeah.
So today we've got a hot topic. We've got weight loss medications, the
Yes.
GLP-1 medications. You're
Yes.
seeing that everywhere.
Everywhere, yes.
Yeah.
So they really kind of hit the scene on a quiet note about probably 5 years ago. So GLP medications have been used with the diabetic population for a very long time. So we have a lot of history and longevity and knowing that it works safely with them. But then we started to notice that people on the GLP start to lose weight. So probably about 5 years ago-ish, they just sort of trickled into mainstream. And the first kind of hit the market was something called semaglutide, which is like a generic version of Ozempic, right?
Okay.
And basically what these medications do is they do two things. They actually work on your hippocampus to kind of turn down that outside food noise. So you just don't feel as hungry, you're not thinking about food as much. And then they actually slow down the motility of your stomach, so you're eating about 1 to 2/3 of what you'd normally eat. So that puts you naturally in sort of a caloric reduction, right? So people are losing weight. And I've been in this industry for 30 years doing, health and wellness and chiropractic and all these things. And this has definitely been one of the best tools that we've ever had. But they're not a magic wand.
Right.
People think they are.
Yeah.
They expect them to just do all the heavy lifting. But if you're not doing the back things like eating enough protein and getting enough water and exercising and making good choices, they can actually cause some damage. One of the potential problems is there is a real risk of people losing muscle mass. And muscle, as you know, is our anti-aging organ. We want to maintain as much muscle mass as we can into old age for longevity purposes, just for strength, for good posture, for preventing injuries. If you fall, if you have more muscle mass, you're just in better shape. Just everything. You're going to burn more calories at rest, so your metabolism's going to be better. Just all of these things that muscle is so important.
Yeah.
So some people are kind of finding them, maybe on the internet or on these more sort of back alley kind of situations, you know what I mean? Yeah. And I think it's really important to work with a provider that kind of knows about these and has experience with this and can help you guide down the path. So we offer GLP medications here. It's definitely just one of the tools in our toolbox. We can combine it with other strategies, like we have the mSculpt Neo, which actually helps build up muscle mass. So those two are a great combination together because as you're losing that fat, you can actually build up muscle organically with this device. You just lay on the device for 30 minutes and it actually is like the equivalent of doing 50,000 crunches for you. So it really builds up muscle mass quickly.
Yes.
And it also helps reduce volume too. So that can be like a great combination. Sometimes people are dieting to get to the point where, maybe they feel good everywhere, but they just have a little pocket somewhere that they're just concerned about.
Yeah.
So we could employ these other strategies to reduce the volume at those areas so they don't have to lose so much weight.
Yeah.
You know what I mean? And just what I've noticed in kind of working in this industry for so long, at some point, your face and your fanny just kind of don't match up like they used to. You know what I'm saying? So sometimes you lose weight and then you just look a little bit aged because your face is a little bit thinner, those kinds of things. So we can kind of balance the weight loss, maintain the muscle mass with good management and good dietary choices.
Yes.
And then also support. And sometimes too, people as they lose weight, they also get a little bit of skin laxity. So we have a lot of devices that can help with that as well. Just really tighten that skin, plump it up, make sure it looks vibrant and yummy.
Yeah, all the good things, right? And I love too that you're a doctor too, so the steps that need to be taken. And I feel like with that guidance, it's so much easier and nicer for people who want to do this product. Just to have that peace of mind.
Yeah, absolutely.
Yeah.
And sometimes, just depending on kind of where people are metabolically when they start, sometimes they are a little bit more insulin resistant. So sometimes the medication doesn't kick in and you don't see that scale reduce quite as quickly as you expected. So that's another important piece of things to know, like is your waist circumference getting smaller? Is your waist to hip ratio getting improved? You know what I mean? There's other matrices that we can check.
Yeah.
And sometimes we need to do labs just to see kind of where you're at as far as metabolism and that kind of stuff.
So come in for a consult. You would be happy to help anybody else. We so appreciate you and everything you do and all your knowledge.
Thank you.
Thank you so much. We appreciate it. And until next week, on Live It Up.